My name is Jessica Shiraku. I work at the Physical Medicine Center, which is part of rehabilitation medicine, and it includes physiotherapy, occupational therapy, speech and language therapy, and orthopedic technology. I am a physiotherapist by profession, and I work with patients. Physiotherapy in itself means that we are treating patients by use of physical means, other than the use of drugs. So our patients come in, they are evaluated, and we use our hands to actually restore them to full function or to help them heal and feel better. We take care of several conditions. There's stroke. Stroke is a sort of a condition that paralyzes a patient on one side. We take care of patients with paraplegics. Those ones after an accident, you lose the use of your lower limbs, or quadriplegic, where we lose both upper and the lower limbs. Then we also take care of the normal office problems or back pains. Back pain, as you know, is normally brought because of inactivity or too long sitting in an office. It's commonly known as ergonomics. So we take care of that, reducing pain and helping patients heal. We use several equipments or agents to reduce the pain. For example, when we are treating a back pain, we use things like shortwave diathermy, ultrasound, heat treatment, or cold therapy, basically to help reduce the patient's pain. In stroke rehabilitation, we actually ensure that the patient goes back to almost maximum capability, because sometimes you know that after stroke, you will never be the same again, because it's happened, it's damaged part of your brain, and you are not able to do what you're supposed to do. So physiotherapy comes in that you are not going to be dependent on other people, but you can actually do what you should do yourself. Physios, as I've said, as we are shortly called, also helps a lot in physical activities. We have realized that most of our people live sedentary lives. They hardly ever exercise. They hardly ever, walk. You get into the car, you go home, you go to the office, and that is all that you do. So what physiotherapy does is that we go sometimes to people's offices, we talk to them about the sedentary type of life, the exercises they're supposed to do. We encourage people to go to the gym so that you can actually avoid these other conditions that come in. Because you can easily get stroke or hypertensive because of lack of exercises. Even the diabetes, if you are not exercising, you can end up even getting things like diabetic. So it is important that you actually do your exercises as much as possible. We also have speech and language, which we deal with here. And speech and language is not just a disease that you can say it comes immediately. You can get a speech and language problem right after birth, which is called congenital, or you can acquire it. How do you acquire it? This is the time when, for example, you get stroke, and you've seen those people who get stroke and they're affected on the right side of the arm, they are not able to speak. So that is the time when the speech and language therapist comes in to help you actually regain or restore your speech back. Then we also have the one that you are born with. Sometimes children are born with problems. They are not able to speak, okay? Also, what the speech therapist does, they help those children now start acquiring speech. It's a long process, but actually it works.
My name is Duncan Kyengo, and I'm an occupational therapist by profession. And perhaps I would start by explaining what occupational therapy is all about. It's a branch of rehabilitative medicine or physical medicine, which is mostly concerned with restoration of the performance aspects of human being, either especially after sickness. It comes a time when the function of a human being, especially the so we call ADLs, it's an abbreviation for activities of daily living, and they are a little bit broad, from the basic one, which we call them the instrumental ones. All human beings across the board. So apart from the basic ADLs now, we also have other issues. For example, like writing, yeah, very important, signing, and many other aspects of human performance, like those ones. Now, how do we do this then? Occupational therapists apply activities, purposeful activities, which are goal-oriented to retrain, okay, the lost aspects of human function. There are very specific things that a baby is supposed to do. For example, when a baby is born, in 3 months, you expect a baby to have health control. In 6 months, you expect a baby to sit. And in 9 months, you expect a baby to stand. And in 10 months, you expect a baby to walk. Okay? So when you see a baby who is 3 months and this baby hasn't not yet gained head control, trust me, you should start getting worried straight away from the word go. The multidisciplinary team comprises of a large number of professionals. To start with, we have our consultants in their respective areas of specialty. Like we can have pediatricians, we can have surgeons, okay? Then we have physicians at the same time. So when you go to the physician with a problem, then the consultants now, they narrow down to what your problem is. At the end of the day, they might send you for an assessment. Then we give a feedback on how we feel, or according to our opinion, how this problem can be managed.